Hi everybody! How's everybody doing? Can you hear me all? How do I do this? Anybody there? Can you guys see me? Oh no, hold on. There we go. Okay, this is my first time doing this, so I'm not too sure what to do. Cancel! Okay. There we go. Awesome. Okay, let's get this started. So I'm Adrienne. Hi, yay! Okay, you guys can see me, great. So I'm Adrienne. Hello, hi everybody. I'm a Chinese medicine practitioner. Some of you might have remembered me from about a week and a half ago when I treated Emanuela for her broken rib. We did that live treatment, which was amazing. I think you guys, if you did see that, you get the idea that I love what I do. I'm super passionate about it. I could go on for hours and hours and hours. I won't do that today, but it is a passion of mine, my job. Hello from India, that's amazing. Okay, great. So I'm here in Kelowna, BC. So a bit about myself. I graduated, I have a degree in kinesiology, and then I went on to do a doctorate of Chinese medicine. After that, I did a year of sports medicine specific training in San Diego, which was amazing. I'm born and raised in Nelson, BC. So if anybody does know where Nelson is, it's a little hippie town. So lots of acupuncturists, lots of herbalists around there. I was exposed to acupuncture at a super young age. I played competitive soccer, so I was always injured. I was seeing the acupuncturist once every couple of weeks. I found that it was the best way to get my injuries under care and get back on the field. So that's kind of the history of why I went into it, just exposed to it at a really young age. So the topic is called Why TCM. Oh, hi everybody. Illinois, USA. That's great. Share the love too, you guys. So let's talk about Chinese medicine and its history. So they're not really too sure when Chinese medicine was created. Anywhere between 2,000 and 6,000 years ago is basically what they say. The majority of our textbooks are between 2,000 and 3,000 years old. I mean, the classics, that's where they're basically from, is 2,000 or 3,000 years old. So a long time ago, but there's been bone fragments and bamboo needle-like substances found that date back to 6,000 years ago. So when these artifacts were found, they did think that they were used for acupuncture needles way back in the day, which is pretty cool. And also another thing that that does date it back about 6,000 years old is that they found so many mummies, very well preserved mummies, that actually had acupuncture points tattooed on their body. So this one mummy in particular, I think he's called the Iceman, but he was found, and with his leathery skin, he had all these tattoos of very anatomically located acupuncture points on his body. So when they actually opened him up, they noticed that he had terrible gut issues, whether it was Crohn's, diverticulitis, whatever. His intestines were completely destroyed. And then upon further investigation of the points that were actually tattooed on his body, they had seen that these are points that an acupuncturist would have used to treat that type of condition. So lots of history with Chinese medicine. It's been around forever, which is one of the main reasons why I think it's the best medicine out there. If it wasn't any good, it still wouldn't be here. So cool, right? So a lot of people, when you think of Chinese medicine, they think of just acupuncture, but Chinese medicine encompasses so many other aspects of healing. So my two biggest ones, of course, are acupuncture and herbal medicine. I'm a herbalist as well. I find that to get the best results the quickest, whether it's pain, fertility, dermatology, pediatrics, whatever it is, I find that a combination of both acupuncture and herbal medicine gets the best results the quickest. So on top of that, acupuncture or Chinese medicine also, we also use Tui Na, which is a Chinese medical massage. Qigong. So Qigong is more of a form of exercise used to balance the body. Yang Sheng Fa, which is the dietary therapy of Chinese medicine. Again, a huge other topic I could go on for hours on. But the biggest thing with Chinese dietary therapy is that you are eating within the seasons and you're eating within your surroundings. And depending on what constitution you are, of course, there's going to be foods that one person would choose over another. But the biggest thing in my practice that I always preach, I hate using the word diet, but the 100-mile diet, if you are from, say, me being from BC, my body is going to react the best eating foods that are grown within 100 miles of myself. My body will not react the best if I'm eating a whole bunch of tropical fruits and things that are grown across the world. Make sense? I just think it makes so much sense, and that's kind of the guidelines that I do follow for the dietary therapy. And then, of course, moxa bustion. So I think I did some moxa on Emma with the live video. I can't remember. But the only way to describe moxa, it's a Chinese herb that I light on fire, glows red hot. It's called mugwort. Mugwort is the Western herbal name for it. It's magic. It's totally magic. I don't really quite understand how it works. Apparently it's a specific frequency of heat that it emits, but I have been able to treat so many amazing things with moxa, just with like waving this heat over specific points or over a portion of the body. Like, it's amazing for bruising, contusion, broken bones, any sort of skin condition. And then also if I have an acupuncture point that I really want to get stimulated, you want to, if you just moxa that acupuncture point, it'll really increase the effectiveness of that needle. So moxa is magic. I would like to do another blurb on moxa in a different video, because again, I can go off for hours on it. But I think with the purpose of this video, we'll just dive a lot into the acupuncture portion of TCM, and save the herbal part for another video and all the other stuff for a different time. So I get asked every single day, how does acupuncture work? How can sticking like a little needle in my body create such a profound effect? So it is opening up a can of worms asking this question, but I'll do my best. There is no short answer, but yeah, so just bear with me. It is a little bit complex, but so within our body, we have 12 regular meridians, and there's 8 extraordinary meridians. So a meridian is a longitudinal vessel of energy that carries chi throughout the body. So, and all these there's branches off these meridians that reach other places of the body. So chi, what is chi? And that is, again, another whole entire video. Some people in my doctorate did their whole thesis on what is chi. It is like a vital energy, and we were taught by the classics that it's a relationship between two things, between heaven and earth. So one good example of how you can feel chi is, say, my friend is at a desk writing down on a paper, and I go and I grab her pen. That energy felt in that moment between her and I, that is chi. So it's an untangible, vital life force that drives our whole entire body in Chinese medicine. So moving along. So each of these 12 meridians is paired up with another meridian. So you've got your lungs and your large intestine, and also runs through a pair of organs in the body. So you have your lung, your large intestine, your spleen and your stomach, your heart and your small intestine, your sanjiao. Your sanjiao is your triple warmer. It can be kind of described as the connection between all the other organs, almost like a fascial system. Now that fascia is an organ itself, some people say that is the sanjiao that's just finally been exposed. But I mean, Chinese medicine, we've known it for thousands of years, that there is some sort of connective organ that runs through your whole entire body called the triple warmer. So that's paired with your pericardium. Your kidney and your bladder are paired, and your liver and your gallbladder. So along these meridians that we have throughout our body are acupuncture points. So the acupuncture points are where the energy or the chi from the meridians comes up to the surface of the skin, and it's almost like a well of energy. And through a needle, this well of energy can be manipulated by that needle. So every single acupuncture point has a very, very specific anatomical location, a depth the needle can go to or should go to, just a specific angle. Some needles are perpendicular, other ones are on an oblique angle. Some are like if you're doing scalp needling, you want to just barely underneath the surface, and you're needling that in 2 2 to 3 inches. And then along with that, you have your functions from one to several functions for 1 point, the indications of those functions, and of course the contraindications. So of course there's organs everywhere inside our body. You don't want to be shoving a 4-inch needle through our back. Of course you want to make sure that your lungs are there. You're only going in at 1/2 inch, and then also like all the peripheral nerves in your body. So there's tons of contraindications. So every needle is very, very specifically located, and they're all along these meridians. I mean, there are points that aren't, but we'll get to that later. So remember how I said that the meridians pass through different organs. Every organ has a specific function and indication, and even holds a specific emotion. Of course, when you think of these organs, you think of the Western medical physiology of them. Of course, the organs do the same things that you would hear about in Western medicine, but there's also so many other functions of these organs that they have. So through the whole interrogation that I would have with my patient upon first coming to see me, we collect all their health history, all their current conditions. We'll find out where these pathologies and imbalance are lying in their body. And generally there is an organ specifically imbalanced, judging by the different patterns of symptoms that you see. A lot of the times it's several organs, and then it's more or less working together with all the organs, or picking or choosing which is the worst and kind of going from there, or which is the first organ that became imbalanced and going from there. So on top of that, meridians, back to the meridians, they have a very strong relationship with the fascial planes of the body. I know I'm throwing this word fascia around a lot, but it's so important when it comes to Chinese medicine, because I think that a lot of our acupuncture points are they work so well because of this fascial system working on the fascia. So the meridians, the longitudinal vessels of energy, that run through our body, a lot of these are along specific fascial planes. So a fascial plane the fascia is almost like the connective tissue that joins things together, and also it's almost like a sausage covering that connects different muscles together. So there's muscles that will be working synergistically that are connected together along one specific fascial plane, and a lot of the times this fascial plane is following a meridian. So, for example, you have a fascial plane that is your posterior chain line. So from your forehead all the way down the top of your head, down your neck, down either side of your spine, down into your glutes, your hamstrings, your calves, and the bottom of your foot. So that's one fascial plane, and that is also following the bladder meridian line. It's exactly to a T, it follows it completely. And by saying this, so if I was to stick a needle in the fascial plane of my bladder meridian up here in my back, and I stuck the needle down in my low back, I could wiggle that needle down to my low back and it would move the needle up here. Of course, there's a skin connection as well, but the fascial connection is so strong in Chinese medicine, and that is kind of a lot of what we base our pain management on as well. Okay, so when treating pain with acupuncture, of course, we will be treating the site of the injury, where the pain is. But because of this massive fascial connection and the meridian longitudinal vessels, we want to be treating on either side of that injury as well. So, for example, a super common issue that I see with anybody at a desk is that pain right here. I'm sure you guys know what I'm talking about. So this area here, although it's like a rhomboid minor levator scap area, that is on your small intestine meridian. So there's the same fascial connection that comes through here, runs down your arm, into your elbow, and then to the end of your pinky here. So if I'm treating here, of course I'm going to be needling into this area. Of course, that's going to be the first place that I want to go. But then I want to be needling especially into here, to this muscle, the flexor carpi ulnaris. This muscle has a very profound effect to release this area right here. So again, in Chinese medicine, you're not treating just the one side of pain, you're treating the whole entire body, because 9 times out of 10, where the injury site is not where the problem is. It's going to be tension on either one or the other side of the meridian, or even on the other side of the body. So it's just not, you'll just be chasing symptoms if you're always just hammering into that one side of pain. So in Chinese medicine, it's a whole body thing. So now that I've kind of discussed the idea of how Chinese medicine works, I'll get a bit more into why I choose TCM over conventional medicine. I mean, don't get me wrong, if you're injured, go to the ER. Like, there's a time and a place for Western medicine, and I have nothing but respect for it. When it comes to preventative medicine and living a more holistic lifestyle, I think that TCM is definitely where it shines. But even things that Western medicine can't really explain, there's usually always an explanation in TCM. TCM stands for Traditional Chinese Medicine. Okay, so when you go see a traditional Chinese medicine practitioner, you're going to be asked a million questions regarding your current health history and your current issue. So we look at everything. We look at your life. We look at your career, your stress. What are you doing day to day? Are you a swim instructor and you're in a pool submerged in water all day? I mean, that could create dampness in your body. Or are you a mountaineer? You're on the top of a mountain all day. Are you commuting to and from work an hour in the morning and an hour in the evening? Are you sitting all day? Are you exercising? What's your living environment like? Do you live in an old house full of mold, or do you live beside an industrial site, or do you live in the forest? All this is so relevant and so important when looking at where your imbalances could have occurred. We look at your diet as well, of course. What has your diet been like the last little while? Was there a change in your diet when you started to have these symptoms? Have you been eating foreign food lately that you really eat at all? And then, of course, your stress level. Do you have stress? I mean, everybody has stress. Do you have any specific excessive emotions even? Are you overly fearful of things? Are you anxious? Are you living a very anxious lifestyle? Are you easily irritated or angered? These are all things that come into play. Are you even excessive joy can be seen as a pathology in Chinese medicine. Are you sleeping okay? Are you waking up throughout the night? Your family history, super important as well. Are there certain pathological patterns that we've seen in your family? So these are all aspects of a person's life that may need to be altered in order to achieve wellness, but we literally look at head to toe, inside and outside even. So one of the biggest diagnosis tools we use is tongue and pulse. So your tongue, it's a complete representation of what goes on the inside of your body. In Chinese medicine, it's like your tongue and your pulse are the two main diagnosis tools. In China, there's even Chinese medicine doctors that only look at your tongue and your pulse. They don't ask you any questions, and they do a whole incredible treatment based on what their findings are. And they're always right. So the tongue, we look at like the color, the shape, the size, the texture, the coating. Is there a coating? If there is a coating, is it thick? Is it white? Is it yellow? Is it on a specific location of your tongue? Everything is super relevant. Also different areas of the tongue represent different organs. So if your heart is the tip of your tongue, the liver is your side of your tongue. If you're a really anxious person, a lot of the times you'll see a really deep red tip of your tongue, which is indicative of heat in your heart. When your heart can have excessive amounts of heat, you can create anxiety. So tongue is super important. The other one is pulse. We use your radial pulse, 3 positions on each arm. Each position representing a different organ. So we look at the speed of the pulse, the quality of it. Is it really forceful? Is it weak? Does it feel slippery? Does it feel like a wire? Again, all super indicative as to what's going on in the body. So one of the last things we look at is past traumas, so both physical and mental. So this is very important. I mean, it's super important, but I find if a patient comes in with an illness and we can't see any sort of pattern, we look into the past. We look into their past history. Was there a spiritual trauma, emotional trauma, physical trauma that occurred maybe even years prior to this illness popping up or immediately after this occurred? So again, super important. And then for women, of course, we're looking into your cycle and your hormones. How many pregnancies have you had? Have there been any issues along those lines? This all becomes super important with diagnosis and all these factors that come into play when looking for how imbalances in the body occurred. So when we look for these imbalances, generally an illness isn't caused by one in a patient history, but it's usually found that there's an emotional component to everything. So going back to the organ systems in Chinese medicine, every organ has a specific emotional component. Like I said, with the heart, it's more anxiety. So for example, the lungs, they deal with grief. So I see this in clinic all the time when somebody is going through a lot of grief. It's very common that they get sick after, usually with like a lung congestion, head cold, anything like that. Large intestine. So what does your large intestine do? It lets go of your waste. So in Chinese medicine, if you have an inability to let go of your mental waste, a lot of the times we see physical symptoms such as constipation, even diarrhea sometimes. So again, looking at seeing this person walking in with bowel issues, normally if there isn't any other rhyme or reason as to what's going on with them physically, we look at the emotional component. Oh, did they have a past trauma that they have been unable to let go of? That's where we would go. So the spleen, your organ of digestion, it's more about overthinking and worrying and contemplating, thinking about how your appetite can really change depending on how worried you are. So there's that connection there. The heart deals with joy and anxiety. The kidneys are your fear organ. So think about if you're really, really scared, you might pee your pants. There's that connection. Also, I've done a lot of pediatrics and treat a lot of adolescents, and bedwetting, it can be an issue getting late into the teen years. And a lot of the times when I'm treating those teens, guaranteed there is a fear component as to why this is all going on. So, and then the liver, of course, the big old liver deals with stress. It makes you angry. I always throw liver points into my patients because just Western world, day-to-day things, everybody's always stressed out in one way or another. So when choosing what point to use on a patient, I always take the emotional aspects into consideration again. So in TCM, we look at the whole picture of your life. We make custom changes to the patient's lifestyle, environment, alter their diet, counsel them emotionally, and then let the needles and the herbs do the rest. And when you do see a TCM practitioner, it's not one treatment. I mean, generally we're looking at years and years of build up to become the symptoms that they are today. So to undo those poor imbalances and those postural dysfunctions or whatever it is that I'm treating, it does take a long time. So it's creating that relationship with your practitioner because you're going to be seeing them for a long time, eventually until it becomes more of a preventative thing. Like generally when I see patients for pain, it might take 2 or 3 months to get them out of pain, but after that I'm seeing them once a month, once every couple months, and then maybe once or twice a year just to maintain that preventative medicine standpoint. But with TCM, it's not you're coming in, you're getting fixed, you're leaving. It is a lifestyle change for a lot of people. But these changes need to happen for the person to be in balance. So what do y'all think? Where are the liver points? Okay, so the best one that where's my little mannequin? Just a sec. Okay, so my favorite liver point is Tai Chong. So you can see that it's just between the first and second toe. So when you put your foot on top, your hand on the top of your foot, you'll feel where the bones split to make your first and second toe. So the liver point, it's always really good to massage for acupressure if you are feeling angry. So just pressing right distal to that branch in those toes. It's about an inch, so an inch proximal, so an inch towards your body from the webbing between your first and second toe. So that's my favorite point. I put it in every single person. It can really calm you down. It feels great. So, yeah, any questions? Let's get some questions going. Anybody? Questions? Okay, no questions. Well, I hope you all enjoyed the chat. Oh, hold on. Let me see if there's more questions back here. How do I know which needles to use for treatment? Okay, so there we go. So how do I know which needles to use? So first of all, the gauge of the needle is more dependent on the person. If somebody is super sensitive and they're super nervous, I will use the thinnest needles that I have. I find that, well, of course you're going to get the same reaction, but I won't be able to manipulate them as hard as I would a regular size needle. But I find that for people who are really nervous, I generally use like the thinnest ones possible. And then of course, depending on where I'm needling, if I'm needling into like my hand, I'm just going to use a 1-inch needle. But if I'm needling into somebody's like deep hip muscles, I can use up to like a 5-inch needle. But generally like hips are about 3 inches. Neck and back are all 1.5 inches. Yes, let me get the different needles here. One sec. Okay, so we'll start from the smallest. So these are needles that I would use for the ears. So super, super small. These just go in, I don't even know, a couple millimeters. And these are kind of like the regular size that I would use. So it's about 1 inch long. So for like arms, hands, and feet, I probably go through these the most. 1.5 inches. So these are really good for like quads and upper arms into like the neck and shoulders. Those are always, these are always good ones. And these ones you don't really need to be too careful with, because if you are needling the upper arms and the quads, you don't really need to worry about going too deep with these. One thing is the handles are skin colored, so you can never forget to take those out, because they can sometimes blend into your skin. 3-inch needles, so these ones are good for lower back and hips. The longer they get, the thicker they get. That doesn't mean that they're more painful, but for somebody who's really sensitive, I would have to be cautious about using a lot of these, because they are thicker, they do cause a bit more trauma, but these are one of my favorite sizes as well. You can just get anywhere with these ones. And then these bad boys, these are my 5-inch needles. So these are good for getting into like the deep aspects of your hip, or for people who, I mean, for even like low back points, but mostly I use these for deep hips, or if I'm threading underneath the skin from one area to another. One treatment that I can do if there's numbness, I could put a needle in here and then thread it underneath the skin to about there. So I'd be using a longer needle for that as well. So dry needling and pain management. So dry needling is a different form of acupuncture. It can be a little bit more aggressive than just your regular style acupuncture. But for pain management, I'm not really too sure how to answer that question. So, I mean, how does it work with pain management? So when you're needling into an area, whether it's dry needling or acupuncture or just regular acupuncture or whatever, when you're needling into an area of pain, what happens is that the needle is creating a trauma within that area. So the needle is kind of like messing up the muscle fibers or whatever, and that creates a massive immune response. So your body is like, what's going on here in the spot? Your body sends a whole bunch of blood and nutrients to that area to try to figure out what's going on. So when it comes to pain management, that influx of blood and nutrients can really help to heal the area of trauma. So I hope that answers your question. How do you find a practitioner? Oh, well, it's kind of, Google, Dr. Google is the best one. I mean, I always love word of mouth. Having somebody who's seen somebody with their experience, I find that it is always the best way to go. But if you don't know anybody in your area, I mean, you can just look online, look at the reviews. Always really, really good idea to look at reviews. As far as my sports medicine training, sportsmedicineacupuncture.com will give you a whole list of all the sports medicine practitioners in all over the world, actually. So that's always a good a good place to look. Also, actually, if you're in Canada or the States, if you go to your like your provincial licensing board or your state licensing board, just Google that in, state licensing board for acupuncture. They should give you a list of practitioners in your area as well. Okay, so what else? Any other questions? Dun, 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 dun. How do I know the needle to use? Okay. Oh. Yes, there we go. Thank you. sportsmedicineacupuncture.com. So that is the amazing practitioner, or the sports medicine program that I did in San Diego. Seriously, the 1 year of sports medicine that I did in that course was like, I learned almost more than my 5 years of Chinese medicine. The most life-changing thing I've ever done. And it's, yeah, I learned so much there. So any other questions? I don't think there's anything else I could see up here. No, we're good? Okay, well, thank you everybody for tuning in. Herb. Oh, hello, Melanie. Hi, Melanie was one of my patients in Fort McMurray. Nice to see you. That's awesome. Very, very cool. Okay, guys, so I think that's it. Good herb to use. Okay. Hi. Oh gosh, Nancy, good herbs to use. I mean, that's a open-ended question. If somebody comes in and they want a herbal formula, I am asking a million different things about what goes on in their life. There's no one good herb for everybody. I mean, there kind of is, but I don't even want to go into that yet. So it's really dependent on the person, because what could be a good herb for one person might not be a good herb for another person. So we can maybe talk about that on a different video. So my next topic, oh gosh, what's my next topic going to be on? Maybe I'll talk about Chinese herbs and moxibustion. I really like to talk about moxa for sure because it's so fascinating. And then maybe we'll dive a little bit into the herbal therapy aspect of Chinese medicine as well. Sound good, you guys? The best forms of exercises I recommend. Well, that's it depends on what the issue is. Totally. Like, I mean, if you have an acute injury, you don't want to be, throwing a 80-pound bar over your head. That's for sure. But that's kind of a hard question to answer. It really depends on the issue. All right. Any other questions? All right, you guys. So I guess I'm signing off. Yes, thank you. So keep posted on keep watching the Facebook page to see when I'm talking next. But yeah, I think we'll do the next topic on like moxa and Chinese herbs. Yeah, I got a couple more ideas of different topics to talk on, but I think that's where we'll go next. Awesome. Okay, thanks you guys. That was really great. Oops. All right, guys, signing off. Bye. Thank you.